This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from the campus of Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 526 for October 12th, 2022. We're calling this one Toddler Behavior. I want to welcome everyone to the program. Our behavioral health panel is back in the house this week, and we really need them as we consider a topic that is often on the minds of parents with young children, and that topic is toddler behavior. Because toddlerhood can be a bit of a mystery, right? I mean, it's a time of discovery and developing independence. Terrific. It's also a time of tantrums and breakdowns and opposition. Raising toddlers is definitely challenging work, but we can ease that challenge by first understanding the behaviors that are normal for toddlers. In other words, what is expected? Because if we know what is normal, we have a better idea of what is outside of normal and the instances in which our toddler's behavior might need a little attention and or correction. We'll cover many aspects of toddler behavior today, including what is normal, of course, but also what sort of difficulties arise in the course of playtime, bedtime, mealtime, and potty time, because those are really the big times a day for toddlers, right? They're either playing, eating, sleeping, or going to the potty. We'll also consider daycare and toddler difficulties that take place outside of the home. And to help us consider all of these things, our behavioral health panel is here once again. Dr. Kristina Jiner is a pediatric psychiatrist at Nationwide Children's Hospital, and Dr. Ariana Hoet is a pediatric psychologist at Nationwide Children's. You may be wondering, what's the difference between a psychiatrist and a psychologist? We'll provide a refresher for that question, and we'll also take a dive into normal toddler behavior, common challenges parents are certain to face, and practical strategies for effectively meeting toddler challenges head on. However, before we get to our guests, I do want to remind you, you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. Also, please consider leaving a review wherever you listen to podcasts so that others who come along looking for evidence-based child health and parenting information will know exactly what to expect. We're also on social media. We love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. And if you'd like to reach out and ask a question or propose a topic for a future show, easy to get in touch. Just head over to PediaCast.org. That's the homepage. And you'll find a contact link there. Just click that link, and I do personally read all the messages that come through. So if you have something on your mind, please do let us know. Also want to remind you the information presented in every episode of the podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get our expert panel settled into the studio, and then we will be back to talk about toddler behavior. It's coming up right after this. Dr. Kristina Jiner is a pediatric psychiatrist at Nationwide Children's Hospital and an assistant professor of psychiatry at The Ohio State University College of Medicine. Dr. Ariana Hoet is a pediatric psychologist at Nationwide Children's. She also serves as clinical director of the On Our Sleeves movement. More on that to come. And she is an assistant professor of pediatrics at Ohio State. Both are passionate about helping young kids and families live their best lives, which includes raising awareness about normal toddler behavior and empowering parents to engage toddlers effectively and implement strategies to correct behavior when things go sideways, which can be a common occurrence as we think about toddlers. Much more on all of this to come, but first let's say hello to our returning guests, Dr. Kristina Jiner and Dr. Ariana Hoet. Thank you both so much for visiting with us again.
It's great to be back. Thank you.
Thanks for having us.
Yeah, absolutely. We have done several episodes on PediaCast, and we have all of the episodes plus some more behavioral health topics packaged together in a playlist over on SoundCloud. And I'll put a link to that playlist in the show notes so people can find it easily. But just some of the things that we've talked about, depression and anxiety in kids and teens, preventing teenage suicide. We've talked about managing holiday stress, which is will be a good one to listen to again as the holidays will be soon approaching. Helping kids and teens through the school year, tackling boredom, bullying, self-care and wellness for moms, and much more. So please do check out that playlist over on SoundCloud where we have all those episodes packaged together. Before we get started with toddler behavior, Dr. Jiner, could you just sort of remind us, I mentioned that you're a psychiatrist. Dr. Hoet is a psychologist. What's the difference between psychiatrist and psychologist, and when would a family need one or the other?
Sure. So great question. So as a psychiatrist, I am a physician. So I was trained in medical school and then went on for additional training. I typically will meet families when there is a concern for the need for treatment involving medication or the need for more diagnostic assessment.
Okay. And then a psychologist?
So psychologists go to graduate school to get a PhD or a PsyD in clinical psychology. And so when it comes to behavior, we're trained in how parents can respond to a child's behavior. How do we know what's developmentally appropriate, as you mentioned? When do we start to worry? And then we can do assessments and evaluations for diagnoses.
That makes sense. So psychiatrist is a medical doctor who then goes into behavioral health, and a psychologist, it's a graduate degree, so you don't have to study all the rest of the body, just the brain, the nervous system, and behavior.
Correct.
And development is probably an important part of that too. Speaking of behavior and development, we did mention we wanted to start with kind of what's normal for toddlers, because I think a lot of times our expectations are that a toddler is going to sort of sit there like a school-aged child can do, and pay attention to something and follow directions, but that's not always the case, right?
No, this is definitely a time of limit testing, and we start to see their preferences and, again, just pushing the boundaries. They're building independence. They're building their sense of self. They start to identify who they are and how they're different from others. They also have curiosity, lots of questions about the world. And so it's a lot of changes during the toddler years, definitely.
Yeah. I love that you started with the they're gaining independence, they're exploring, they're very curious, all of these things. And then you can sort of understand why that all of a sudden turns frustrating if they're trying to understand something and they can't, or they really are wanting to exert their independence and maybe you're not letting them. And so this is also a time when kids can be oppositional. What are some good practices for dealing with oppositional behavior when toddlers don't want to do what you want them to do?
Yeah. And one thing that just came to mind as you were talking is I often remind parents that the toddler brain or the child brain is not developed yet, and it won't be for many, many years. And so having the expectation that they're not seeing the world or processing the world like we are is important. When it comes to oppositional behaviors, there's things we can do to try and prevent them. So routines are super powerful for toddlers. It gives them a sense of control. They know what to expect, but it also may avoid power battles. If we do the same bedtime routine every day, they know what to do. They know what to expect. We don't have to argue as much about it. It's also helpful to be clear with our expectations when we're talking to toddlers. So it's saying be good, be respectful. It means something different to them than it means to us. So trying to talk to them more specific. I want you to sit quietly. I want you to share your toy car. And being really specific with what behaviors we want. And then no matter what, even if we have those routines and we're talking to them clearly, they're still toddlers, so they're still going to push and sometimes be oppositional. And so some of my favorite strategies are giving them choices, giving them that sense of control. Do you want to put your PJs on first or brush your teeth on first? And let them tell you what to do. But you're still kind of giving them the two choices that you're okay with them choosing. Another strategy is thinking about toddlers often tell us what they're feeling with their behaviors. So being able to help them with emotion regulation. They're still learning what emotions are. They're still learning to express them. Sometimes we need to give them space, let them have their moment, their meltdown, and that's okay. Sometimes we have to help them regulate. Be there. Do you need my help to calm down? Label their feeling. I can tell you're really angry and that it's frustrating that we have to put our toys away to go to bed. And then help them. Maybe you do bubble breathing together, belly breathing, and helping them regulate and calm down.
Yeah.
It's really, really important that we pay attention to how we're responding to the oppositional behavior because we can accidentally reinforce it. Go ahead.
Yeah, if we're giving them more attention, if they get attention with bad behavior, then, hey, it's attention.
Yes. Or we give them that thing that they're crying about, right? Then they're learning by accident that, hey, every time I cry, I'm going to get that thing that I want. So sometimes we have to be aware that we validate the emotion and the frustration, but we stick to, we still have to put that away. Or sometimes even implementing consequences, taking something away because they're not following through.
I think one little thing that parents can do, even just to get started with that, is to be careful what you threaten, so to speak.
Yes.
So in other words, make sure it's something you're really going to follow through with. I can remember we were at the Ohio State Fair this year, and there was there were several kids who were tired of being there and, really cranky. And the parents were like, if you don't stop, we're going to go home. And I just thought, you just paid, however much money for these tickets. You're not taking that kid home.
Right. Exactly.
So make sure you really can follow through with it, or they will learn that they can still get their way.
Yeah. They're smart. So they'll learn like, oh, my caregiver just says that, right? And so yes, that's very important. And I recently had an experience with my daughter where she wasn't letting me do bedtime routine. So I said, well, we're not going to read a book unless you put your PJs on. And I thought that's something I can easily implement. And she was so sad. I mean, it was heartbreaking. And that's something I hear from parents all the time, right? Like, I don't want to make my child sad. And she was heartbroken and kept saying, well, now I'll listen. It took everything in me to say, we'll try again tomorrow, but today you lost that privilege and I understand you're sad, and kind of helping her distract and regulate that emotion. But it's really hard.
Yeah. And so maybe in the future you would have picked a different consequence.
Yeah, or maybe, we read 2 books, and maybe I would have said, now we're only going to read one, and made it less severe than taking both books away.
Yes, exactly. Speaking of toddlers being smart, they do ask a lot of questions, and sometimes it can be, it can wear you down, just the number of questions. What are some good practices for engaging the questions, but also helping turn them off when it's enough?
Yeah, that's hard. I mean, again, they're curious. They're learning about the world. And so being able to answer their questions at the developmental stage, so small tidbits of information. If they're asking more, they want to know more. But sometimes you'll notice you give them that answer and they kind of stop. They're processing. They're thinking about it. So they kind of hit their limit of the information they needed. And then sometimes we may have to say, like, I'm really busy right now. Let's talk about this. Let me finish this, this job that I'm doing, and then we can talk about that situation. Yeah. But definitely engaging them as much as possible.
Yeah. And if you do put it off, maybe set yourself a timer, you just to remember, and then it's going to mean a lot to them when, okay, now I'm fresh. I'm ready to answer their questions. And from their point of view, like, you're coming to engage to answer their questions. Yes. That's kind of a cool thing, I would think.
Yeah. And visuals are helpful. A sand clock, for example, where they can, they can't read time yet, but they can see that sand clock's running out.
Oh, yeah. I'll answer your questions when the sand is gone. I love that. Yeah. Playtime, I imagine, is really important for toddlers. And we did a show, it was actually episode 519, called The Power of Play in Childhood. It was actually our sports medicine people that did that. It's a really good episode on just how we learn so many life skills through playing. But especially during the toddler years, you may have to jumpstart that playing a little bit. And we have both sort of structured play and then unstructured play. So what's the importance of those, and how can parents best encourage their kids to have productive playtime?
Playtime is great, all the reasons you mentioned. And we also use it a lot in therapy to build the relationship between the child and the parent. We do something called child-directed play often, where we ask parents to pick 10, 15 minutes a day where it's just them and the child. And they're letting the child lead, what the child wants to play. And really, it's all about showing the kid, I'm here, I'm paying attention. So we recommend reflecting back. So saying what you hear the child say, just echoing it, describing, I see you put the blue block on the red block, mimicking. So if they're jumping, you're jumping. If they're coloring, you're coloring. And then praising, making it fun, and trying not to ask questions, trying not to give directions, just again, letting that child lead and feel listened to, attended to. Building that positive relationship with the parent is a wonderful way to use playtime.
Yeah. So you really want a nice mix of both of those things, right? Where you are getting down and playing with them, but then when you also encourage them to start using their imagination and making stuff up on their own.
Right. And kids love having our attention, and we often notice that they tend to act out when we are distracted, when we're not paying attention. So encouraging that independent play too is really important, and saying, okay, like you said, using your imagination, letting them be bored and figure out how to play is really important, because they're learning, and it encourages that alone time too.
Yeah. And again, we'll put a link to The Power of Play in Childhood, PediaCast episode 519 in the show notes so that folks can find it easily. Now, one thing that can frustrate a lot of parents is you think if I got a room full of toddlers that they'll all just play together and keep each other entertained, and then, we can do something parently. That's not really true, though, is it? I mean, at what point can we expect toddlers to be able to play with one another versus just independently playing in the same space?
Yeah, it's a great question. So around 2 years old, we start seeing toddlers do what's called parallel play. So they're playing next to each other, but not with each other. And then from 2 to 4, maybe they're playing with the same toys in the same area, but they're still not doing what's called a cooperative play. We see that more at 4 years old on. And that's when you see them maybe build that block tower together, right? And not just next to each other. So it does take until around 4 years old to start kind of distracting and entertaining each other.
Yeah. So we really, to think that they will just get along and cooperate with one another and play together may be unrealistic before age 4.
Sure. Yeah.
Okay.
And it takes a lot of setting expectations and practice and rules for sure.
Yeah. And then how do you go about resolving conflicts once they are playing together? Because even 4 or 5-year-olds, like if it's my toy, I may not want to share it with someone else. Yeah. Or, you're really learning to take turns sometimes too, right? That can be tough lessons.
Absolutely. I always say if it's not hurting anyone, if it's not disruptive, let them figure it out, right? Again, we want them to develop that problem-solving skill, the social skills. Let them talk through it. If it does get to a place where the behavior is disruptive or someone's getting hurt or they're coming to you, then it's okay to help them guide through it. What are you feeling? What's happening? Let each child express what's going on and then help them with the problem solving. Again, establishing the expectations very clearly, the rules very clearly, and practice.
Yeah. But then if they're in danger of harming themselves or each other or objects or property in the house, then you may need to intervene.
Yes. And in those cases, again, as I mentioned earlier, think about what reinforces behaviors and thinking of if it did get too disruptive, someone's getting hurt, we may have to give a consequence. We take away that toy, we have a time out from each other, and just making sure that they learn this is not acceptable behavior.
Yeah. As we think about acceptable behavior and consequences and just ways of dealing with behavior that we may not like. So for some people, it may be just distracting them and you're okay with that. Others, you may want more concrete rules. And if you break this rule, this is the consequence. So houses even can sort of deal with these things in a little bit of a different way. And then when we add daycare or going to the babysitters, they may be handled in a completely different way there. How can parents best juggle their kids being in more than one supervised environment where maybe the rules are a little different?
Yeah, it's an excellent question because kids do need that consistency. And so talking to the daycare providers, a lot of them will often ask you for their routines in writing. My daycare has asked me, when she's upset, how does she calm down? How can we support her? And so allowing that communication between the childcare provider and the caregiver to talk about the routines, how do we implement consequences, how do we help calm down, that's really important to make sure everyone's on the same page. And I would say the reverse. Sometimes in therapy, I hear families tell me, oh, they're perfect at daycare, but then at home they're not. And so we've talked about, well, how do we implement the daycare routine in the home? How do we replicate school at home?
Yeah. And that may be tough too, because kids are more comfortable around their parents, right? So they're that filter for going ahead and doing the bad behavior, because you may know it's not quite right.
Right.
And so when you're with strangers, you may be able to hold on to that, but not when you're at home. So what do you do in that
Yeah,
case?
and there's peer influence too.
Oh, yeah. Like, my friends are behaving, so maybe I should behave too. So how do you, I don't want to say get rid of that familiarity at home. Like, how can you make kids take the rules seriously at home with the same amount of seriousness that they do at daycare? I guess picking the right consequences.
Yeah, it's consistency, right? And then I always want to remind parents to validate the emotion that, it's okay to feel angry. It's not okay to throw that toy, right? And so we're supporting that they continue to feel safe at home and to be themselves at home, while also being consistent with consequences that do matter to them.
Yeah. And then how should parents respond when the daycare comes to them and says, hey, your kid's been acting up? They've been doing have been involved in behavior that we don't condone. How do you deal with that in your kid? Because a lot of parents are surprised that their child may have bit little Billy, right?
Right. Yeah, I mean, if the child at home is not around 10 other kids, right, their behavior is going to be different at daycare than it is at home. So it can be surprising. And I think that's where communication is key. I mean, for me, I want to know what's happening before that behavior, what's happening after, how are we responding? I recently had an incident where my daughter was biting at daycare, and I had never seen that at home. So I asked the teachers, well, what's happening right after? And they were putting her in her own little space, giving her a little toy to play with. And I said, well, that's actually reinforcing the behavior. Now she gets her own alone time and her own toy.
Yeah.
And so I told them, as a parent, it is okay for me if you take all the toys away, take all the kids away, and say, biting is not okay. And you give her kind of a timeout from attention and fun, and she's going to cry, and I'm okay with that. So it does take that communication between the caregiver and the daycare to figure out what the consequence is and saying it's okay for you to do that.
And we have to think about the consequences and whether this is something that they would like to do or not. Because otherwise it's like, who can I bite next? So I can get
I get my own toy.
Yeah, exactly. I mean, that's smart, right?
Yeah, right.
Now, what about when the opposite is true, when maybe your child is the one being bitten? Obviously, now it's not only a matter of, hey, this is not appropriate behavior, but like how then do we assimilate the child back into the room and sort of get everybody trusting one another again?
Yeah, it's again that communication, right? Figuring out what's going on. Is there certain moments that are leading to that confrontation between the kids? How can we prevent it? And then one thing that's important is continuing to expose the child to those environments, right? You mentioned how do we get them back into that environment, and talking to the little ones of, yep, that happened, and we talked to the teacher. We're going to find ways to make it better so that doesn't happen again, and continuing to take them to the daycare and encourage those pro-social behaviors.
Yeah. At what age can you talk about what happened? So like if, a child who did get bitten may have a lot of feelings about what happened and maybe why that happened. And not only now maybe fearful, but wondering like, are they a good person or a bad person? Mm-hmm. Do you know what I mean?
Yeah.
So at what age could you start talking through feelings with young kids?
Yeah, it's hard because they understand a lot more than they can express to us. And so I would say start talking about it right away. But at first they may not be able to share back. So we see more of the behavior, right? Maybe they come home and they're extra sad, they're crying a lot, or they're not listening. And so that tells us today was hard at daycare, that incident did upset them. And so just talking to the child through it and helping them regulate distractions. But as they get older and they have language, they can tell you a little bit of, I'm sad or I'm angry, and being able to let them express their emotion, validate the emotion, and then problem solve of how can you respond next time? Yeah. How do you say, don't touch me, don't bite me, and teach those assertiveness skills from a very young age.
Yeah. It seems like it would be an important thing, and for all of us to talk about our feelings more, and within the context of the safe space of the family, to be able to explain how you're feeling and talk through that. And part of that is also parents being in touch with their feelings and being able to share their feelings with their kids. And then your kids will pick up on that and hopefully start sharing their feelings back once they have the language.
Absolutely. I think parents often feel like I should hide those things. I need to protect them. But then that sends the message to kids that it's not okay to feel certain emotions. Yeah. So instead, talking about them is really good.
Yeah. Now, obviously, if you're feeling sad as a parent all the time, maybe you need to get professional help,
Right.
and it's not something, that you want to be talking 24/7 with your kids,
Right.
but it's a part of that everything in moderation and being transparent with one another. Let's move on from playtime. I mentioned that we're also going to talk about mealtime, sleep time, and potty time. And Dr. Kinnear, let's start with mealtime. Toddlers can certainly be picky eaters. What are some ways that we can encourage them to try more things?
Absolutely. So toddlers, they're exploring their world, and now there's more foods to try. And one day they may love a food, and the next day they want nothing to do with it. And so again, like you said, how do we help support that? And so a couple of recommendations is, making mealtime enjoyable. So a family sitting around together, eating the same foods, and role modeling. Hey, I'm going to try this carrot, or I see big sister trying a carrot. Maybe I'll try a carrot too. Offering a child a safe food, a food that they're more than likely to eat, but other new things on the plate as well. Making the food fun. So fun shapes, triangles or stars or moon shapes, so a child can pick them up pretty easily. Kids love to eat with their hands, so encouraging that as much as possible. Giving them things to dip into. So kids love to dip, whether it's ketchup, whether it is sour cream, yogurt. Giving them some options and allowing them to play with food. So, sometimes we're taught like, no, don't let kids play with their food, but this is how they explore. So it's okay if they put the food to their lips, if they lick it, but then put it back on the plate, or if they put it in their mouth and spit it out, they're exploring. And research has shown that it can take many, many, many tries of a new food before a child's going to be like, yeah, I like that. I'll eat that again. So I think, again, trying to make mealtime as pleasant as possible, so we don't get into power struggles. I always say, parents decide what there is to eat, and children decide if they're going to eat it or not. And just being consistent. You may have to try those green beans multiple times before they'll even, acknowledge that it's on their plate. And that's okay. That's okay.
It seems like you want to be there for your kid at mealtime to make sure they're not going to choke, or that they're being safe. But other than that, you might want to put blinders on, because I can just imagine, watching a kid make a mess out of their meal when maybe you worked hard to put it together, and you're proud of this meal, and you want a nutritionally complete dining experience for your child, and they're throwing it on the floor. But you may just need to ignore that a little bit, right? Distract yourself with the other grown-ups at the table, and just, turn the other cheek.
Exactly. Yeah. And enjoy yourself. Have conversation that isn't about food. Mealtime shouldn't be stressful for the child. It shouldn't be stressful for the caregivers either.
Yeah.
So enjoy yourself.
You just have to get the older kids to clean up.
Yes.
That makes that easier. Toddlers often are also slim eaters, and when I did primary care pediatrics, this is something that I heard almost on a daily basis. You'd have toddlers come in and they don't eat like they used to eat. And I would always show parents the growth chart and say, look, when they're babies, you look at the curve is, going straight up. They're really growing. And then when you hit 2, things start leveling off until, school age. And so that toddler years, they're not growing anything like they were when they were little babies. And we eat to grow. And so, of course, your appetite's going to be less if you're not growing as much. So I would always, reinforce, let's look at the growth chart. And if they're where they're supposed to be on the growth chart, then they're eating the right amount. When should parents worry that maybe their kids aren't eating enough, or they aren't eating enough of a variety of foods?
Sure. No, that's a great question. One thing I think is to kind of look at the big picture, right? So maybe lunch today doesn't go well, but what's eating like over a week's time, right? So is the child eating something? Certainly we worry if children stop eating altogether, or if they're refusing to drink, or there's other signs that something's going on. So they're not acting like themselves. They're, vomiting, diarrhea constantly. Those are reasons to get them, of course, to the doctor. But like you said, if the growth curve looks good, that's reassuring. And I think that can help parents, kind of take a deep breath. I think the other thing too is remember their portion size is going to be a whole lot smaller than it is for even a school-age child. So, a couple of tablespoons could be a serving size of vegetables. And so not like, the cup size of vegetable an adult might put on their plate. And so each little bit counts. And so every bite counts. But I think really working with your healthcare provider to know where is my child from a health standpoint.
Yeah. And that's an easy thing to do because they have that growth chart right there on the screen that they can pull it up and show you and then give you hopefully some reassurance or let you know, yeah, we do need to get extra help. And there are feeding clinics for kids, who may have aversions to certain textures. And, there's a very small number of foods that a particular kid will eat for one reason or another. And if, it can be a problem if they're not, getting all the food groups in. So definitely, keep in touch with your child's doctor for sure. Now you had mentioned, so the parent's job is to pick which foods and the child's job is to pick, kind of how much and when. So what do you do when a kid refuses to eat especially at mealtime, like time and time again?
Right. So I think, one of the things too is we don't want to get into a power struggle about that. And so we do want children to learn to listen to their bodies. And so it's within reason, of course, to say, you're listening to your body. You're not hungry right now. Okay. Mealtime's over. Now, if the child reappears 5 minutes later and wants a cookie, that's a little different. We can offer the foods that were offered at the meal before. So we don't have to say, okay, well, if you don't eat now, but 5 minutes later, you can come back for a snack of a cookie or ice cream or something like that. I think, again, just being consistent about mealtime. So kids thrive on consistency. And so this is the time we eat. This is the time we sit down. Again, just involving kids with food. Like I said, they like to play. So maybe having them help prepare meals or help pick out foods at the grocery store that they're interested in. Now, of course, they may not eat any of it at mealtime, but they're getting involved. And then I think the other thing too is to remember there's no good foods, there's no bad foods. So food is food. And like you said, we eat to grow. And so modeling that for kids as well too. And then making sure not to use food as a reward or a punishment, because then kids will really pick up on that and see that, oh, well, when, I did something nice, then here comes a cookie for me. And so now I'm going to hold out for the cookies, or things like that. So I think, and again, following up with your primary care provider, if a child's growing well, then we know, even though it may not look like it on the surface, that they're eating well. And so just, it's hard. It's frustrating, of course, especially after you've prepared a very nice meal. But to remember that they're listening to their bodies, and we definitely want to encourage that.
Yeah. In listening to their bodies, then they may not be hungry at dinner time, especially if they had a big snack in the afternoon. And a lot of parents, you don't think of juice as being a big snack, but it actually, it's full of sugar and, it really satisfies your body's hunger. And so you may not be hungry at dinner time if you had a big glass of juice in the middle of the afternoon. So just kind of keep in mind what your kids are eating during the day. And I love what you said about even if they come along a half hour later or even an hour later, it's probably okay to warm up that meal, right?
Absolutely.
You're not getting the cookie when you didn't touch your dinner at all. Okay. That's how it was in my house.
Yeah,
All right, let's move on to potty training. This one is really a question that a lot of parents have. Like, when do you start? How do you know when to start potty training?
So a couple things that to kind of keep in mind is a child has to be ready. And when we say ready, that's ready from a variety of standpoints. So one, physically ready. So, can a child like pull off their pants, for example, kind of a elastic band. We don't expect buttons or anything like that. Can a child physically walk to the potty? So if they're not walking, if they're not able to do those things quite yet, then they're not quite ready. The other thing is just physiologically, like the body's really not ready until, you get to about 12 to 18 months. You have to be able to, kind of stop urinating in order to make it to the potty. And so if your body's not ready to do that yet, potty training isn't going to be successful. And also, too, you want a child who is ready, who's interested. If you get out of potty and the child wants nothing to do with it, you talk about using the potty and the child screams and runs into the next room, probably not ready. And yes, you could try, but it's going to be really challenging for you as well as for the child versus a child who, you put a play potty out, their animals are pottying, they're sitting on the potty, clothed or otherwise, and really shows an interest. And like, hey, I want to do this, or I have a wet diaper. I don't want this on anymore. So we're really looking for those clues. So usually somewhere around, every child's different, of course, but usually after about 2, closer to 3, we start to see that all like the stars align, if you will, and they're ready to go.
Yeah. So when they start talking about it, when they're asking to be changed, when they're showing interest, usually at that point they're physically ready. Usually, so that can give you an idea. And when you had said make meal times fun, potty time can also be fun in many ways. And there are books about potty training, and you know how kids like to read the same book over and over and over. You know what I'm talking about. Reading and having a character who is learning how to go to the potty may be someone that your child can identify with, and they want to hear that story over and over again. And there are books out there. And then, of course, one of my favorite all-time children's books is the poop book. Have you seen that one? Like all things poop, or everybody poops. Oh, that is a wonderful book. One hump camels make a one hump poop. I don't know. I can still picture it. So there are a lot of fun things, and then of course positive reinforcement stuff like sticker charts and a reward system, and can always be motivating and fun. But we also want to be careful not to punish failure, because that can make things more difficult, right?
Absolutely. So again, it's a learning process. And just like any of us are learning, there are going to be some good days and there are going to be days that aren't so good. And so children are they're people pleasers. They want their caregivers to be proud of them and to be happy with them. And so we don't want to develop that shame. And so one thing you can say to a child who maybe just had an accident is, I know you're trying, and I know this can be challenging sometimes, and I know you can do it. We're going to get you cleaned up and go about your day. And so that's, of course, easier to do the first time it happens. Not so easy the 10th or 12th time it happens that in the same day, but just remembering the child's learning. And so the more calm we can remain and not punishing, not being punitive, the more likely the child's going to be successful.
Yeah. Is there ever a time when you're like, we just need to take a step back from this and we'll try it again in a couple months?
Absolutely. So I always think too, not only does the child need to be ready, but life needs to be ready. So if a new sibling just came into the home, that's probably not a great time. Maybe there's a new job, parent is stressed with that, maybe not the greatest time. Or, a family member gets ill, and it's okay to take a pause. The vast majority of children are going to potty train. I've heard it said, children don't go to college in diapers, so you'll get there. It'll happen. And so it's okay to take a break if you need to. It doesn't mean that you've done something wrong or that the child's done something wrong.
Yeah. Maybe just people weren't ready yet. Yeah, that makes sense. Let's move on to bedtime, which can actually also be can be a struggle and a battle of wills sometimes. What are some good bedtime routines that will lead to success at kids staying in bed?
Yes. So much like eating and toilet training, this can be a bit of a challenge. So I think, one thing is again, having that routine. So we recommend, and this is for children of all ages, of course, to turn those electronics off an hour before bed and not have electronics in the room if at all possible. And then having your routine, whether it's a bath and PJs, brushing teeth and story, or whatever that routine is, giving your child choices like we talked about. So do you want to wear the blue pajamas today or the green ones? Do we brush our teeth first? Do we put our PJs on first? We've got 3 books. Which book should we start with first? So giving as much control as you can, making sure that a child has perhaps something that is very special to them, whether it's a stuffed animal or a blanket, that can provide a lot of security when the caregiver leaves the room, helping making sure that, is a nightlight necessary? Does the child prefer the door to be open versus shut? Those are all things that can set a child up to be successful.
Yeah, so really important because if they're playing and having a great time and there's a lot of energy and activity going on and all of a sudden, boom, it's bedtime, that's probably not going to work out well.
No. So definitely having that kind of wind down time, which is, so it may not be, especially for, busy families, bedtime's probably not going to happen in under 5 minutes. And so allowing yourself that time that you'll need to be successful.
And you need that wind down time, but it also helps if there's a period of pretty good activity before the wind down time starts. So not right before bed, but after dinner, having a little action might make it might help wear them out a little bit.
Absolutely. Yeah. Plenty of physical activity will help.
And then what about how much sleep do toddlers need? I mean, we always hear 7 or 8 hours of sleep for adults. What about toddlers?
So from 1 to 2 years of age, they really need anywhere between 11 to 14 hours. And of course, that includes naps. By that time, closer to 2, they will definitely be down to 1 nap a day. And that might be 2 or 3 hours. And certainly if you're noticing problems getting them to sleep on time, maybe that nap's too late in the day or it's too long, your child will let you know. But definitely they need more sleep. And so we know that overtired children will have a hard time getting to bed. And so sometimes if a child's too tired and it's just frustrating every night, they actually need an earlier bedtime rather than a later one.
And not enough sleep can make you cranky. And so some toddler behavioral problems might just in and of themselves be fixed by getting more sleep.
Oh, yes. I think that's true for all of us.
Yeah.
Regardless of age.
Yes, absolutely. And the other thing I want to really point out for folks, you mentioned that naps count. So when we say that young kids need 11 to 14 hours of sleep, that's in a 24-hour period, not necessarily just overnight.
Yes.
Yeah, really, really important to remember. And then what about those trouble kids who you get them off to bed and, they're in a toddler bed now and they know how to open doors and you're ready for adult time and your kid keeps coming down. How do you get them to stay in bed?
Yeah, so that's also a challenge. So one is trying to kind of anticipate reasons that they might have a valid reason to get out of bed. So do they need to use the potty? Do they need a drink of water? Did they have, are they full? Some children, depending on what time bedtime or dinner was, maybe they're hungry. And so kind of a rich protein or healthy fat snack before bed can help keep them full. Addressing things like anxiety. Some kiddos, we know fear can show up in this age and show up in a variety of ways. And so, sometimes you might need to be looking for monsters under the bed or behind the closet, making sure, we have light so the child can see. And then if you've kind of addressed all of that, and now you just have a kiddo who's coming out, we don't want to give it too much attention. So oftentimes just walking the child back to bed, again, not having a conversation, not letting them know that like, oh, hey, if you come out, mom's going to talk with you and play with you. No, we're going to get you tucked back into bed. And we'll continue to do this. And over time, the kiddo learns like, yeah, nothing fun happens. And parents aren't doing anything fun either, so might as well stay put. You can do things, certainly as kids get a little bit older, like a bedtime pass where you say, okay, here's your ticket. You get 1 trip out. And if you still have, you use your ticket or you have a ticket left over, then there's a small reward the next day. It can be helpful. Usually that's a little bit much of an older child.
Yeah, absolutely. My daughter, it's funny how kids can be so different one to the other. So my son, even during the toddler years, you lay him down, he'd go to sleep. My daughter, she's going to miss everything. And so she has got to come up and see what's going on. And we did a sticker chart for her that worked pretty well. And it was one of those, once you got so many, like you got 2 strikes before you were out. So you were allowed to come out twice. But the third time, that's 3 strikes. And so then you wouldn't get to put a sticker on in the morning. And so it was like, how did the night before go? And then I don't know if you remember the Polly Pocket sets. And there was one like this mega set that we found on sale and it had like a ton of little houses and stuff. And so we would say, you get 10 stickers and then you can take just one, not the whole package, but pick one house. And that lasted us for like, I don't know, probably 6 months, like just on this one Polly Pocket set. And it, things went pretty well. Yeah. And then I think in college she slept fine. With her Polly Pockets. All right. So many ways in which toddlers keep us busy, right? And because when you think about playtime, mealtime, sleep time, potty time, that's like all the time, right? With toddlers. And I my hat goes off to parents, and I think that's why younger parents have toddlers than older parents. And for the folks who have more than one toddler at home, that really has to be a lot of work, as you can imagine.
My gosh.
Yes, absolutely. All right. Well, thank you both again so much for stopping by and talking with us today. I do want to remind folks about behavioral health services here at Nationwide Children's because we've got quite the developed program, right?
We do. We have, a full kind of continuum of care, everything from crisis emergency care in our psychiatric crisis department to traditional outpatient setting, whether that therapy or psychiatry with medication management, to additional programs for those who might need a higher level of care, whether that's an intensive outpatient program or partial hospitalization program. And then at the highest level is our inpatient psychiatry for those who need it. We are involved in most of our medical clinics as well, providing support, as well as providing support out in the community. And so definitely a wide variety of options.
Perfect. And we'll put a link to Big Lots Behavioral Health Services at Nationwide Children's in the show notes if folks are interested in learning more about the program. Also, our psychiatric crisis department here at Nationwide Children's, we'll put a link to that in the show notes as well. And then, Ariana, tell us about On Our Sleeves, the movement for children's mental health. What is that all about?
Sure. So we are all about the promotion of mental health and wellness. So we do that by giving any adult with a child in their life the tools and strategies that they may need to support that child's mental health. Just how we promote physical health by eating healthy and exercising, we want adults to know what are the tools that they need for kids to be mentally well. And so all of our resources are created with the experts at the Nationwide Children's Behavioral Health Department, and all based on science and what we know works for children's mental health.
Yeah. And we'll put a link to On Our Sleeves, the landing site for that program in the show notes as well, so that folks can find that easily. And then we'll also put a link to the behavioral health playlist that we had talked about on SoundCloud, and then the Power of Play in Childhood, PediaCast 519. I think that'd be a good supplement to this program if you've not listened to that particular episode before. All right. Well, on that note, Dr. Kristina Jiner and Dr. Ariana Hoet, thank you both so much for stopping by today.
Thank you. My pleasure.
For having us.
We are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guests this week, Dr. Kristina Jiner and Dr. Ariana Hoet, both with Nationwide Children's Hospital. Really appreciate them stopping by today as well. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are also helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show. And we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, Instagram. Simply search for PediaCast. Also, don't forget about PediaCast CME. It is similar to this program. We turn up the science a couple notches and offer free continuing medical education credit for those who listen. And that, by the way, includes doctors, nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by many professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.